Bismillah ar-Rahman ar-Rahim. Our project is doing at Tikrit University College of Dentistry. In this project, we will study the microbial composition and the effect of predisposing factor in fixed denture patients. This project supervised by Assist.prof.Dr. HadeelMizherYounis Mahmoud and Assist.prof.Dr. HadeelMizherYounis, and submitted by the student Ahmed A Kamel and the student Amnah Alaa shhood. Replacing missing tooth, helping individual to chew, maintain muscle tone, restore or improve the patient's ability to speak and pronounce word better. But the application of fixed or removable prostheses may change oral ecology either quantitatively or qualitatively, such as increase total amount of oral microorganism or increase certain part of oral microflora. Why our study is important? Different studies have suggested that oral bacteria may be a risk factor for a number of prevalent systemic disease. So, increase oral bacteria will increase the systemic disease, and there is a relation between the systemic disease and the oral microorganism. Because, or an example for that, have been implicated number of bacteria, like a bacteria that cause endocarditis, aspiration pneumonia, gastrointestinal infection, and chronic obstructive pulmonary disease, and dental prostheses over reservoir for microorganisms associated with this infection. Denture wearing has been associated with number of microbial disease like denture stomatitis and malodor, and also suspected to serve as a reservoir for respiratory pathogen, and this will cause pulmonary infections. The aim of our study. The aim of this study was to determine microbial contamination of fixed dental prostheses with the objective of assessing microbial contamination at different interval of usage. The 2 points to determine the effect of predisposing factor in patients with fixed bridge. Now we will talking about the fixed bridge. Who is or what is the fixed bridge? The dental bridge literally bridge the gap created by one or more missing tooth. So the fixed bridge will replace the missing tooth. It's made of 2 or more crowns for the teeth or on either side of the gap. These 2 or more anchorage teeth are called abutment teeth and false tooth or teeth in between. These false teeth are called phonetic, made of gold, alloy, or porcelain, or combination of this material. Dental bridge supported by natural teeth. The advantage of the bridge is restore our smile, restore ability to chewing, maintain shape of our face, distribute force bite on replacing missing teeth, and prevent remaining teeth from drifting out of the position. In this slide, we will say the type of the fixed bridge. The first type, traditional bridge and cantilever bridge and Maryland bridge, and this is implant-supported bridge. Now we will talking about the second thing before the entry of oral microbiology, denture stomatitis. The denture stomatitis is common infectious condition affected the mouth of individual who use denture. It usually affects the hard and soft palate on the mouth, but may separate to involve cheek and mouth corners. The denture stomatitis caused by oral microorganisms that constitute the oral cavity biota. Also, the fungus can, like the candy albicans, can also find in this denture stomatitis. The infection caused redness of the roof of the mouth, also pain, irritation, burning sensation. The sign of symptom of denture stomatitis may include red inflamed area in the palate, pain, difficulty wearing denture, presence of ulcer on the mouth corner, difficulty in eating and drinking. Now we will enter the oral microbiology, and I will left my partner to complete this section of the project.
Assalamu alaikum. After my partner talking about the beginning of the subject, we will talk about the oral microbiology. Oral bacteria have evolved mechanisms to sense their environment and evade or modify the host. Bacteria occupy the ecological niche provided by both tooth surface and gingival epithelium. البكتيريا راح تكون موجودة بالمكان يعني بالtooth surface والgingival epithelium. However, a highly efficient innate host defense system constantly monitor the bacterial colonization and prevent bacterial invasion of local tissue. A dynamic equilibrium exists between dental plaque bacteria and the innate host defense mechanism. دائما حيكون أكو توازن بين البكتيريا الموجودة بالفم وبين مناعة الجسم. Of particular interest, the role of oral microorganisms in the two major dental diseases, dental caries and periodontal disease. Oral pathogens, we will talk about the species of the bacteria that's found in the oral cavity and effect on it. Streptococcus mutans, as we know, it's gram-positive cocci-shaped bacteria, facultative anaerobes, are commonly found in the human oral cavity and is a major contributor of tooth decay. The results of decay can greatly affect the overall health of the individual. The transfer of genotypes are responsible for the transmission of Streptococcus mutans from the mother to their children. Also, there is genotype variation from one population to the next. Viridans Streptococcus, large group of commensal Streptococcus gram-positive bacteria species that are alpha hemolytic, producing green coloration on blood agar plates, hence the name viridans from Latin viridis, green. Viridis means green, so it's green. Streptococcus salivarius, it's a species of spherical gram-positive facultative anaerobic bacteria that is both catalase and oxidase negative. Streptococcus salivarius usually enchains the oral cavity and upper respiratory tract of a human just a few hours after birth, making further exposure to bacteria harmless in most circumstances. The bacteria is considered an opportunistic pathogen, rarely finding its way into the bloodstream or is being implicated in cases of sepsis in people with neutropenia. Pyrovatilla intermedia, also its rod-shaped microorganism and anaerobes. Porphyromonas gingivalis. This B. gingivalis invade human gingival fibroblast and survive in it, and it also doesn't affect with the antibiotic. Tranilla forsythia, anaerobic gram-negative bacteria. Fusobacterium species and Villanella, and there's a lot of bacteria, Campylobacter and Capnocytophaga bifidobacterium, and that's it. Periodontium, cultivable microflora of denture plaque includes Streptococcus species, Staphylococcus species, Actinomyces species, and Villanella. Streptococcus mutans is so important because it can predominate in dental plaque and etiological associated with dental caries. Microbial colonization of the mouth, how the bacteria colonize in the mouth. Here we say that more than 30 genera of bacteria have been detected in humans. 25 are regular members of oral flora. These belong to both anaerobic and aerobic group. On average, 750 million microorganisms are found in each milliliter of saliva. How the attachment of bacteria on the surface. A. Initial colonization and bacteriology of stable implant. Fundamental physical molecular principle of cell attachment, adhesion to microbial colonization, and host integration. Thus, there is implant material that and the roughness of the surface which contribute in adhesion of the bacteria on the surface. Here we say that the root surface, the attachment of root structure is more than the attachment of the titanium, which is the implant. Microbial colonization of stable osseointegration implant supporting fixed prostheses. The microbiota of remaining teeth is properly the primary source of putative pathogen to colonize adjacent implant. من يكون الدبث مال السلكاي normal, microflora in implant sulci is similar to tooth sulci. As a result, in implant susceptibility to inflammation is the same as teeth. Dental plaque composition. Denture plaque develops from adherence, aggregation, and growth of microbes from saliva, oral mucosa, and possibly fingers in the absence of adequate denture hygiene, and derives nutrients from saliva, oral mucus, and the diet. Plaque accumulate preferentially at stagnant site, offering a protection from fluent mechanical remover forces in the mouth, and the denture provide many such sites. يعني denture حيكون كمكان لإنه البكتيريا تدخل بيه بدون ما تتأثر بالعمليات التنظيف. There is general agreement that denture plaque composition is broadly similar to the dental plaque. It's the same. Dental plaque and denture plaque, the same composition. In the relatively stagnant area of the tissue fitting surface of denture, plaque needs to be more acidogenic, thus favoring streptococci and candida species. Denture plaque, in comparison to dental plaque, was reported to have large proportion of obligate anaerobic actinomyces species. This is the difference between dental plaque and denture plaque. It says that it has large proportion of obligate anaerobic actinomyces, low proportion of gram-negative rods, and regular presence of the skin bacterium Staphylococcus. And the conclusion says that denture and natural tooth surface in health and stomatitis harbor similar bacterial community. Individual related rather than surface specific factor play significant role in bacterial phenotype composition, colonizing denture and teeth. This individual specific mutual influence on denture and tooth surface colonization could be an important factor in maintaining oral health in denture wearers. Discrete differences in colonization patterns for distinct genera and phenotypes warrant further studies regarding their potential involvement or utility as specific indicators of health and disease involvement in denture wearing individual. This is the reference where we make our project, and thank you for your listening, and we're waiting for your discussion.